Good afternoon, everyone. Thank you so much for being here. I am joined this afternoon by Councilman at Large Scott Walker, Councilman Byron Lee from District 3, Councilman Dominic Impastato from District 4. Councilman Van Branken is doing a mass drive right now, and Councilman Edwards cannot make it, and Councilman Templin is in Grand Isle at the moment. Also from the Louisiana Department of Health, our Region 1 Medical Director, Dr. Joseph Cantor, our Coroner, Dr. Jerry Satanovich, Sheriff of Jefferson Parish, Joseph Lapinto, and our Jefferson Parish School Superintendent, Cade Brumley, along with our Jefferson Parish Chamber of Commerce President, Todd Murphy, and Mr. Joe Valiente from our Emergency Management Department. So the numbers just came out from Jefferson Parish. Jefferson Parish, and it's never good to say numbers, but the good thing is the trend of dropping cases of a lower plateau continues. So Jefferson Parish currently has 6,134 cases, so that's an uptick of 31 cases since yesterday and 340 deaths. Certainly our hearts are with those grieving families. We know their sadness in this community, people who lost their loved ones. We in Jefferson Parish government also have had a loss of life in our employee ranks. Especially hit hard is our water department, so we want to make sure they all know that our hearts are with them during this difficult time. Yesterday, our governor extended the stay-at-home order until May 15th, but did announce that there were 3 changes effective May 1st, and that's good news for us. So while the malls are still closed, and you know many of the national franchises wanted to close on their own, but the malls are still closed, but the stores are going to be able to open for curbside delivery. So that is some new, as we see these baby steps coming forward, that is a loosening of the restrictions that he announced for May 1st. Also, restaurants are going to be allowed to do curbside, no tableside service outside. Restaurants are allowed to put their tables outside without service. So you can pick up to go and then enjoy eating, minding the social distance requirements. You can eat outside with your families and enjoy the outside. And we know the medical community tells us that outside is safer than being inside. And then the requirement that all the employees at businesses who deal with the public need to wear masks. And this is a good step forward. We need to get our businesses ready for this preparation as we look into moving in phase 1 in the future, and we hope that that future will be in mid-May. But certainly there's work for all of us to do in the business community to do on that front, preparing for that day when we are able to move into phase 1. The CDC and the Louisiana Department of Health also recommend that everyone who goes out in public should be wearing masks. This is a courteous thing to do. If everyone does that, that's very important, and we know we can reduce the spread of this virus in our community. He explained that we as a state do not meet the gating criteria, the White House gating criteria, to move into phase 1. We are certainly, in the good news for us in this region, we know we got hit hard early in Region 1. The Region 1 for Louisiana is Jefferson Parish, New Orleans, St. Bernard and Plaquemines Parish. So we look good in our region, but the rest of the regions trail behind us. In fact, Region 2, which is very close to us, is still increasing in terms of cases and hospitalization. So it's always been certainly my position that this shouldn't be a parish-by-parish move. We should move at the very least as a region, if not as a state. And very close regions near us, like Baton Rouge, are still increasing with this virus. I certainly know that's the news that we didn't want to hear. I fully believe that that's not the news the governor wanted to deliver. But again, the numbers are what they are, and we're not prepared as a state, according to the White House criteria, to move to the next phase. I want to let the business community know that I certainly understand the hardship that everyone faces. There's hardship around. My family is from a small business. I understand trying to survive, and I hope that everyone, I've always felt that we as a community are going to get through this together, and certainly appreciate the support of everyone as we move together as a region, as a state, to get over this crisis that we're having. I certainly appreciate the support, and I stand with the business community as we prepare to get ready for when we can make a wonderful announcement that we will be able to ease the restrictions more so than now. So the governor did explain that when phase 1 will happen, maybe, and we're hoping this will happen in mid-May, we will be able to ease restrictions on places like houses of worship and restaurants, and then open other businesses that have been closed, like the barbershops, like the hair salons. but of course with the restrictions on the occupancy and with social distancing and wearing masks and keeping everyone safe. Again, there is still a lot of work to do on this, and I encourage everyone to let's focus on that, let's focus on getting ready, and let's make sure that if we are able to wait, we will look forward to the day that we will be able to loosen restrictions even more. I want to applaud JEDCO, working with our council, with the chamber, to prepare a plan for all the industries when we're able to loosen the restrictions. It's a very good document. It's in draft form now, but I look forward to sharing that with all the industries as we move toward that day. And let's all continue to abide by the social distancing measures so we can get there by mid-May. That is all of our hopes. The other good news today, and I have Councilman Byron Lee here with us, and I hope he will come up, and I know he was there all morning, but the mobile testing unit is in Marrero, and I'll call you up in a little minute, Councilman, and then I'll be able to. So we want to thank LCMC and West Jefferson Medical Center and the LSU Health Sciences Services for bringing a mobile testing unit to the Marrero Community Center. This is a new way of testing. Again, I'm going to let, after I finish, let the councilman, I know he was there all morning, but a lot goes into setting up this site. So again, we want to thank LCMC for bringing this mobile testing unit with us, with LSU Sciences Center, our own emergency operations staff that have been asked to do so many different things. I want to thank them, our General Services Department, our Recreation, our Sheriff's Office for supporting that site. Also, the New Orleans Health Department. They had a mobile testing unit at Xavier University first, and we were able to go look at that site, and they've certainly been supporting this effort. And also, we continue to test at our Ilario Center. We want to remind everybody that has been a great thing that Jefferson Parish has been able to offer to our citizens. Again, that was one of the first federal pilot programs that came. Jefferson was able to get one site. New Orleans was able to get 2 sites. We test there every day from 8 a.m. Starting at 8 a.m. to any Louisiana resident over 18 years of age. No insurance requirement is necessary. In Jefferson Parish, we're very proud of this statistic. We have tested over 20,000 people in Jefferson Parish. That is a very high number of testing per capita, probably some of the highest you'll see in this country. And really, it's through the effort of so many people, and certainly standing up at our Ilario Center site from the beginning. We are probably testing at a higher rate that will even be, it's almost 5% of our population. Again, a very, very high number we're very, very proud of. We want to thank everyone who worked at the Second Harvest food distribution sites, which have now ended. So they were at Ilario Center on the West Bank, they were at LaSalle on the East Bank, and that is now finished. Again, a huge thank you for Second Harvest and all of the effort that they have been doing through this time. Our emergency management team, our volunteer West Bank firefighters at Ilario, and our East Bank consolidated firefighters at LaSalle Park. I have some other thank yous, and again, this is such a wonderful time of giving. We want to thank Lowe's and Walmart for donating the tents that we're using at the mobile sites, our Bridge City Fire Department for their jambalaya at Ilario Center, somehow I missed that, Smoothie King in Westwego for sending over smoothies, Domino's Pizza I think is sending over lunch today, and we know all the restaurants that are sending food to our hospitals all the time. There is so much giving in our community, which does not surprise me in the least. And again, these masks that we are distributing, our council offices have distributed them. We've given them to organizations, the chamber, JEDCO, the sheriff's office, the school system has these masks we're sending out from Haynes. We want to get these out as widely as possible. We were able to get a great donation from Haynes, almost 190,000 masks, I believe. So we have been spending this week pushing those out. And I want to encourage our seamstress army to keep making those masks. They've been depositing their homemade masks, which I love, into the East Bank and West Bank regional book drops. So we want to encourage that, and a special shout out to Dolores Dolly, Debbie Gares, and Julie Meyer for giving us their wonderful creations with all their TLC and love put into those masks. I'm happy, and Dr. Cantor might talk about this, but surgeries resumed yesterday for those surgeries and those medical procedures that were pushed off because of the coronavirus, and we certainly know that health is important in all aspects, and we're glad that is another step. I mean, I know the governor extended the stay-at-home order, but as you can see, steps are being taken to ease us into the next phase, and this is a huge step for us, that the medical community would start resuming the surgeries and the medical services. With that said, of course, comes with that, we need blood. We need blood donations, so please, I know Oshner has a blood bank. I know the blood center needs blood, so please seek out a way for you to give blood. They have a very safe way for you to give blood. And also, they're asking for recovered COVID patients to donate convalescent plasma. You have to be symptom-free for 28 days. So if you've had COVID and you've been symptom-free for 28 days, please consider giving your plasma, so it might help some people who are very, very sick in this investigative inquiry that they're doing. I also want to say, and I'm guilty of this myself, the JP census, we need you to complete your census. Please do that. You can do that online, by phone, or by mail. The response rate in Jefferson Parish is just 54%. I'm on the guilty side of that. I've been so busy, my own family, and I wanted to get together with my kids and make it a thing and an educational opportunity. And unfortunately, I haven't even been able to do that yet, but it is on my to-do list. Please, we see now federal funding coming down to us based on formulas. And this is so critical that we count everybody who lives in this parish, because our public services really depend on it. So I want to encourage that, and you can visit 2020census.gov. And then with that, I just want to end with thanking our first responders. You know, again, our medical community have been the warriors on this front, and they have been at it for so long, so I want to thank them. But all of our other first responders who are always there keeping our community safe, our sheriff's office, our firefighters on both the East Bank and West Bank, our emergency management technicians, all of the EMS services, along with our very own emergency management team. So we want to thank them for really shining during this time and really making us all very proud of all their efforts. So with that, next I want to thank and offer Dr. Joseph Cantor from the Louisiana Department of Health to come up and give some remarks. Thank you.
Thank you, Parish President. Thank you for your leadership through this. And then I did want to thank all the Parish Council members and other Parish leaders here for just being great public health advocates throughout this whole event. And also, Madam President mentioned the testing site in the Convention Center in Barrero. It's going really well. This was a partnership with a lot of different entities that came together to make it work. A lot of hard work went into it. I really do thank everyone that contributed to it. So the good news, we talked about this last week, is that we as a community have bent the curve. This is what we wanted to do. This is what averted a big spike in hospitalizations that would have overwhelmed the healthcare system and made it so people couldn't get the care they needed. That never happened because people in the community came together, they were responsible, they stayed at home, and we flattened the curve. And we really are a model region for doing that. Looking forward, and to double on what the governor announced yesterday, we'll be looking to reopen very quickly. And it's a phased approach, it's a responsible approach, and it's based on the platform that the White House put out, their reopening plan, which is a good framework. The cornerstone of that plan was some gating criteria that you have to meet before you even can enter in the plan. And as a state, the whole state didn't meet that. Some regions were outliers. Specifically, we're looking at 3 items. We're looking at the number of COVID-like illnesses that present, and that's based on a network of sentinel surveillance sites throughout the state. We want to see that decreasing. We're looking at the number of new diagnosed cases. We want to see that decreasing. And we're looking at the number of new hospitalized patients for COVID. We want to see that decreasing as well. And although Region 1 did very well in those, other parts of the state are lagging a little bit behind. And but we expect that will change likely by May 15th, and that we'll be able to enter in phase 1 of the reopening. Now, the key message here is as businesses and other parts of community reopen, it's not going to look the same. We're going to encourage people to wear masks. We're going to encourage distancing. Businesses are going to be able to serve fewer number of people. The occupancy level will be less to allow for distancing. So it's not going to look the same. And we really ask the public's patience and cooperation through that. President Sheng mentioned that surgeries are slowly coming back online, and that's really good. We want to bring the healthcare system online first in this. So what was announced last week is, in addition to emergency procedures, which had always been allowed, now time-sensitive surgeries and procedures are allowed. What qualifies as a time-sensitive procedure? There's a lot of deference given to the doctor and to the hospital. The overall sense is that we want some more procedures and they're to be done responsibly with care given. So if you have a procedure that has been delayed, whether that's a surgery or a colonoscopy or a biopsy, we'd like you to talk to your physician right now over the phone and discuss whether they think it is time sensitive and would qualify. There's a good chance it would be, and there would be a way to do that procedure safely. And then that will continue to open up as time goes on. You know, one defining characteristic of this outbreak across the state and the country is the racial inequities that we're seeing. As a state, almost 60% of deaths have been African Americans, although they represent only 32% of the population. The disparity is just as stark, if not more so, here in Jefferson Parish, where about 56% of the deaths are African American, who only constitute about 28% of the population. One of the things that we have recognized is that people's exposure risk is not equal. And for example, being able to work from home on Zoom, for example, that's a privilege that not everyone in the community has. So as businesses begin to reopen, we'd like folks to be cognizant of the risk shouldered by people who are frontline workers, whether that's a grocery clerk, whether that's a bus driver, anyone who works and can't do that job from home. That's why we're going to be pushing masks. You know, when I wear a mask, it protects all of you. When you wear a mask, and thank you all for doing so, it protects me. And that's going to be the mindset we're going to ask people to carry forward as they do slowly go to businesses and as things reopen. We want to protect the most vulnerable, and that's going to be a job for all of us together. So thank you for that, and turn it over to Dr. Sertanovich.
Good afternoon. I'd like to share some important numbers and make some recommendations to the public regarding those numbers. You know, over the last 6 and 7 weeks, we've averaged probably around 50 deaths in Jefferson Parish alone, you know, per week due to coronavirus. Now, what we found is that if you take the coronavirus deaths out, okay, and compare to what we normally would expect to see during this same time period, you know, we've got about another 28 to 30 deaths per week that are happening, okay, that are not because of coronavirus. This is in addition to the deaths that we would normally expect. So, reasons for that, there's a whole bunch of reasons. Some of them are coronavirus cases that we didn't report for whatever reason, or we missed. A few of them, but not many. Other reasons could be, and these are concerning, people having a lack of ability to go see their doctor. People afraid to go see their doctor either because they're afraid to get coronavirus, or they're afraid to go because they know that the hospitals are busy and they don't want their problem, whether it's even if it's a big problem, to distract the hospital from what's going on. So my recommendations based on this is, number one, to the public, if you've got a medical issue, you've got to go and get this evaluated. We have too many people dying because of the circumstances, and this is a secondary thing that we don't want to have happen any longer. So you have a medical issue, go see your provider, whether it's a virtual visit or a visit in person. Okay, the hospitals are a safe place, and doctor's office are a safe place for you to go right now. Okay, and and the hospitals, most importantly, have capacity to take care of the problems that you have. So please, we need to stop these extra deaths because of the shutdown. So if you have a medical issue, I emphasize, please, reach out to your provider or go to the emergency room. Thank you.
Okay, I'd like to invite Sheriff Joe Lopinto to come up. Thank you.
Thank you, Madam President. Sad to announce we had another death in the Jefferson Parish Sheriff's Office. Ms. Rose Gowdy, correctional officer for us for the last 21 years, passed away on Saturday. Member of our family. We're going to try to do some things later on this week in order, but if we can keep, her family in our prayers during this time. Obviously, a sad situation. Our Jefferson Parish strength is still very strong. What I'm seeing is, like a lot of other things, I have more people coming back to work than going out at this point in time. We have also had some encouraging news with our sales tax collection this past month, at least for the strength of the parish. March numbers, which if you remember, March was halfway open during that month, have come back and are still coming back that we're due on the 20th. We collected about $4 million less than we did last year's in March, which is about a 12% decrease in our numbers itself. Now that being said, individual industries are affected a lot differently. We had increases in numbers, obviously, at hospitals and different grocery stores, but then significant decreases at retail stores. So the strength of the parish numbers are not horrible, but obviously individual industries are affected differently. We ask everybody to, try to take the different things into mind when we're talking about these stay-at-home orders. That we understand they're not stay-at-home. We understand people are going to travel out and go to do the retail curbside delivery. Take that into mind about buying local. Make sure that our local businesses have the opportunity to be able to survive. Hopefully we can come back from this a lot quicker than we hope, and we can get back to a more normal sense of capabilities. Our April numbers for sales tax collection won't be ready until the end of May, as they're not started to be collected on May 20th. So we'll have those updated numbers then, but just wanted to give everybody an update of where they are right now. Thank you.
Thank you, Sheriff. And I want to invite our Jefferson Parish School Superintendent, Mr. Cade Brumley, up.
Quickly, one of the main questions we've been receiving over the last month just has to deal with grading and promotion of students. And so we recently released guidance on how we will be handling grading and promotion within the Jefferson Parish public school system. That information can be found at jpschools.org. To overly simplify that, what will happen will be that for the first 3 quarters of our 4-quarter year, those grades will be averaged, and that would be a student's grade. However, the 4th quarter, which has been part of the time frame while we've been out of school, through the end of our school year, which is May the 21st, the work that we're providing for students, both paper-based and online, can be used by students to improve their grade. So there will be no harm, but instead it's an opportunity for students to improve their grades by doing work that is supplied by the teachers. So we think that this is a really good opportunity for students who may have a B who want to have an A, or sometimes a student who may not be passing a course, for them to get their grades up and actually pass a course. So we think that this is a good approach. We are handing out paper-based packets today at our 13 grab-and-go sites. We'll do that again on Thursday. But for those parents and students who have online access, we encourage you to continue to go to jpschools.org, where all of the information is there by grade level. Thank you.
Thank you. And Jefferson Parish is very fortunate to have a very strong, very engaged council offices. So I want to invite, and every office is involved in different projects on the front line of this. So I want to invite Councilman at Large Scott Walker, and then also Councilman Byron Lee and Councilman Dominic Impastato to give you their updates.
Thank you, Madam President. I'll be brief. Just wanted to elaborate on what the parish president said a few minutes ago about the mask, the Hanes masks. We've gotten a lot of those, and we're giving them out this week. If you all could help get this out on social media as well when you see it, it would be a tremendous help to the community. What we found on Sunday when my office gave away 5,000 of these at St. Catherine in Metairie is that there is a huge need in the community for these masks. We went through 5,000 in an hour and a half, and there was a significant traffic problem. We apologize for that. Right now, Councilwoman Jennifer Van Vranken is giving out masks at the East Jefferson Regional Library main branch on West Napoleon. As soon as we leave here, Councilman Impastato and I are going to Kenner, to the Burlington Coat Factory parking lot on Williams Boulevard to give away several thousand masks. Councilman Lee, I know, has an event planned for later this week. I think it's been moved to Friday because the weather tomorrow doesn't look so great. So follow on social media, see what we're doing, see where we're going, because we do have a lot of these masks to give away. They are washable, they are reusable, 5 come in a pack. Let's see, where's one of our spokesmodels? Our public information officer, Gretchen, has one on right now. That's what the masks look like. I saw Joe Valiente from the EOC modeling one as well. So they're useful, they're washable, they're reusable. Again, 5 come in a pack. And what we found over the weekend is that people were so appreciative to get these masks because they haven't been able to find them for various reasons. They're hard to come by in a lot of cases. So we're going to do whatever we can to get them out And I hope that Haynes will give us another donation, because we really need more to get it out to the entire community. So thanks for helping us get that word out about these masks.
Thank you. This morning, over at the Community Center on Ames Boulevard, we began providing mobile services in the community. As of 11 o'clock, there were 175 people who had came to that mobile site, and it has been a blessing to the community. I would like to take this opportunity to thank LCMC, West Jefferson Hospital, as well as our parish president and her administration for helping to bring this to much needed areas in our communities. After that location has been utilized, we will be going to other locations, hopefully real soon, Woodmere community, as well as communities more to the west, that is in Avondale and the Wagman area, as well as other parts of the West Bank, Harvey and Gretna. So I want to again commend all of the partners in this because it has been a very successful model that we believe could work and has been successful thus far. Thank you.
Hi, Dominic Impastato, Councilman for District 4 here in Jefferson Parish. Parish President Lee Sheng asked me to provide an explanation and a briefing on a major project that we took on, an initiative that we adopted as a parish administration and parish council just last Wednesday in connection with Jefferson Parish's preparation and readiness to move to the next step and operate somewhat closer to normal in Jefferson Parish. Last week, what we did is adopted a task force and working group initiative where all of our council members, the administration, and even members outside in the public outside of the parish government got together, and we formed 11 different working groups. I'm going to talk about each of them very briefly so you know what they are. But these are all task forces and working groups intended to make sure that Jefferson Parish is prepared to go back to work, prepared to continue business as usual, maybe in a different way, maybe with a mask, maybe with distance, but able to go back to doing the things that we did and carrying on the operations in business that we once knew and loved. First, we're looking at election integrity. How are we able to conduct elections going forward in a way that is safe and careful for all of the residents involved, and then encourage citizen participation in our election process. Our pandemic plan overhaul, looking at our current pandemic plan. How does it need to be modified? How does it need to be adjusted? And how will we be prepared to address issues like COVID as we go forward? Citizen engagement. How are we operating in Jefferson Parish in a manner to bring public in and engage the public into each of the operations within the government, but maybe without having to have physical face-to-face participation? And how can we more effectively communicate with the public? We have a community care and volunteer assistance committee that is intended to coordinate all of the different volunteer efforts like Councilman Walker's talked about, the mask giveaway, Councilman Lee's project, food giveaways that others of us are doing, coordinating those and making sure that the parish constituents understand what resources are available. Perhaps most importantly is the Business Recovery Committee, which was led by a joint effort between the Jefferson Business Council, the Jefferson Chamber, whose Executive Director Todd Murphy is here with us today, and JEDCO, Mr. Jerry Bologna. And what they've done in connection with all of the parish councilmen, councilpersons, and the parish president, Cynthia Lee Sheng, is we've put together a plan, and I'll be quite candid, we were ready to begin the process on May 1st. The plan was in place to start in phases. Again, safe, healthy, controlled, to make sure that the public is not at risk, to make sure that we can do this in a safe and proper manner. Jefferson Parish's plan was and is ready for May 1st. Unfortunately, yesterday, that was taken away from us. And unfortunately, we're not able to execute that plan starting this week. But you can bet we will be ready on May 15th. And we will be pushing from now through May 15th to make sure that this plan is executed and implemented. We also have a committee to move on the East Jefferson Hospital situation, to monitor the progress of the hospital, the financial situation, and to determine whether or not the potential sale of that hospital will be able to go forward as planned. We've got a Hospital and Medical Services Committee that will be monitoring and has been monitoring each hospital within Jefferson Parish to ensure that it has the supplies and resources necessary on a daily basis, whether it's ventilators, whether it's masks, whether it's gowns, and see what needs there are, and can we coordinate and help be a broker or resource to provide them the resources that they need. We have an Education Impact Committee that Superintendent Cade Brumley is the chairperson of, to see what is going on in Jefferson Parish and how is it impacting education and what can we do to make that transition easiest and best. The Government Operations and Return to Work Committee, which is looking at every building, every department, every workforce group within the parish administration and within the parish council to make sure that every department is operating fully and completely to make sure that our citizens have the services necessary to keep this the community that they love and enjoy living and working in. Okay, we are ready. Why does this matter? The parish administration, the parish council have taken the measures to ensure that we are ready to do this. And over the next 15 days, I can assure you, we will be making sure that all of the elected officials in our state are aware of the data, of the science that relates to Jefferson Parish, and our plan that we have in place to operate in a safe manner for the best interest of this public. I can assure you that will be the case. That's what our task forces were set up to do. We've started it, we're implementing it, we're executing it as planned, and I can assure you that we'll be ready as soon as we're given the opportunity, as soon as we're given the chance to execute the plan that we put in place. I can promise you, citizens of Jefferson Parish will be pleased and will be proud of the government they have. As Dr. Cantor stated, because of you, citizens in Jefferson Parish, because of your work, because of your commitment, the numbers are what they are today. The curve has flattened. He said it. They've said we have met the expectations. We've done what is asked of us, and that's why our numbers are what they are. But please don't stop. Please don't give up. Let us each day keep making the case so that we're not disappointed on May 15th, so that we can execute the plan that we've put in place. Thank you, Parish President.
Okay, thank you all for being here. I don't know if anybody has any questions. Yes.
If you could provide some clarification on non-essential businesses, are they allowed to stay open with the less than 10 people, social distancing in place, those type of things?
So remember, the essential businesses are from that CISA guidelines, the Cybersecurity and Infrastructure Act. So those were deemed the essential businesses. They've been open all the time. So the only change to that, and then let's go back to the governor's first order. So the CISA businesses and the essential, I think there's 16 of them. Industries that are deemed essential, you could go to and from work if your work was deemed essential. So those are the 16. Then you had the businesses that were closed. All the amusement parks and the arcades and the hair salons and the grooming businesses, the casinos, the theaters, that group were just closed. And then the way it went is if you fell in between, you were allowed to open, but you had to keep it to a minimum of 10 people. So retail this whole time could have been open, keeping the social distancing in place. Okay, so that's the way it's been. And that's been confusing. I think retail's been a little confusing because I think national retailers on their own closed. Maybe they didn't know that they knew they weren't going to have the business and they couldn't make it work. So it seemed like across the board retail closed, but in fact retail was allowed to open the whole time. I would get calls about certain businesses that were open, and my friends would call me like, why are they open? And I'm like, because they were in that middle group that wasn't closed and that wasn't said that they could open. So now we just look, that was the situation we came into as of yesterday, and now we look at the three new things, which is adding masks, which doesn't really, adding masks to all your employees, the curbside malls. Malls are still closed, but if you were inside a mall, now malls were closed from the beginning because of the food court, because of the crowdedness of malls. So malls were closed from the beginning. So now your interior mall, you can do curbside service. So that's one of the first changes. The second change is restaurants can put tables outside and serve them without waiter or waitress service. And then the third, of course, is the employees that have to wear masks. So I know it's a little, it's in phases and it's a little patchwork, but that's the way it is, okay? And those are the only three changes of May 1st.
I know that now we're not looking at May 1st as the phase one reopening, if it is May 15th, whenever it ends up being, can you just give us a little more detail what people can expect? What will phase one look like? I know I've seen some other states, things like hair salons, gyms opening back up. What kind of changes will there be on May 15th from previously?
So on May 15th, if we're able to move to the phase one, and we're going to eagerly anticipate the governor's announcement, he committed to saying that by May 11th, because you need time to gear up, you need a ramp up period. So by May 15th, it's those things that are closed now. So the hair salons, the barber shops, those things would be, those restrictions would be relaxed. Of course, meeting, social distancing, meeting those things that would have to happen. I think phase one would probably allow restaurants to open interior. You know, so those are the things, if it stays consistent with the White House guidelines. Now the White House guidelines, and if the governor follows that, there were industries that were going to be closed in phase one. Bars were going to be closed in phase one. Youth activities. So when we were preparing for this date, we knew our recreational facilities were going to still be closed. So recreational facilities, and still no visitors to nursing homes and assisted living. That was sort of industries that were kind of singled out as like, you're not going to be in phase one, you're going to be in a later phase. So if the governor's order looks similar to the White House gating criteria in phase one, I think that's what you would anticipate seeing. The governor did indicate yesterday that when we would get to phase one, it would be a 25% capacity. So this is about where your state fire marshal allowed your capacity. It has to do with the space that you have, so every restaurant's different. And it's always displayed, usually near an entrance or behind a bar. You'll often see their certificates. They usually display them all together. You know, the sheriff has a certificate for occupation, and they're all displayed there. So on one of those state fire marshal certificates, you're going to see the number of occupancy allowed for safety measures with regards to fire prevention and being able to escape properly. The governor did indicate that phase one, it would be at 25% of that level. So these are the things that I'm saying we have work to do on the business side to prepare. People need to understand what those numbers are, need to understand how far to put their tables away, need to get masks, for their employees. So there still needs to be some work done, and we're going to be busy working with our business community to get them ready for phase one. Okay. One of the things with hair salons is one of the examples that I read was that probably the waiting room, you'd have to wait outside in your car before you would get called in. So again, every business is going to have to be creative, and we're trying to find the best practices in the industry of what does a hair salon work like. One of my staff members said that they did curbside. They picked up yesterday, and it was great. They had a paper. You had to walk in to get your to-go order, but they had paper on the outside that you could hold a handle with, walk in. They had a tray that they gave you your food on, so they minimized the touches and they minimized the physical contact. So when you think about it that way, you have to really break down all of your business operations, and at every transaction, you're able to minimize that contact for the safety of your employees as well as the safety of your customers. And look, customers are going to want to feel safe when they come in. They're going to want to see that you're protecting your employees because you're protecting them. So I think it's a good business model that everybody really starts thinking it through. And I think people appreciate an employer who is taking these precautions, and hopefully the business will show in that. It will follow with the revenues when we get going. Yes. Any other questions? I thank all of you for being here with us again, and everybody stay safe. Thank you so much.